My focus for the next few minutes is really just going to be on evaluation, but I'm going to try, so I don't want to get too much into the broader theory of resilience or program development and stuff. I want to more talk about the kind of elements that you want to look for if you're actually evaluating whether or not you're promoting resilience. Now, I know that sounds like a kind of a dry topic, but let me just kind of ground this a little bit, okay? Let me give you a small case example. So a little while ago back as a clinician, family therapist that I am, I had an opportunity to work with a young fellow. He's about 12 years old, so within the demographic that you're concentrating on. And he had basically withdrawn largely from school. He wasn't attending. He was truant most of the days. And that in itself might sound like the problem. But in fact, when you got to know this kid, what had happened was that he had one day, a few months earlier, had come home, and his father, who had had chronic depression, had actually tried to hang himself. And the boy had discovered the father in the basement. He'd come home from school one afternoon and hadn't seen his dad, who was at home. It was his mother who maintained the family financially, and the dad was not around. He usually was when the boy got home. The boy looked around for his dad and found his dad had actually literally had the rope around his neck and was hanging in the basement. And the boy, who was just going on 12 years old at that time, thought very quickly. He grabbed his father, was able to sort of somehow, just out of the strength that he had, lift him high enough to get him sort of stabilized. Called, in Canada, 911, I'm not sure what the equivalent is, called the paramedics. They arrived, the police and the fire department and everyone else, and they were able to save him. Now, needless to say, of course, the boy was traumatized by that. The mother subsequently left. She picked up her two children, the boy and his younger sister, and said, you know, I've had it with this man. I cannot continue to live here in this house, and she proceeded towards a divorce. But the interesting thing was that the boy himself said that he's going to stay. To his mind, if he left his father, and if his mother left his father, and if his younger sister left his father, then of course his father was going to kill himself for sure. He had no faith at all in the mental health system that was supposed to maintain his dad. So he had taken it on himself entirely. So he had basically allowed himself to be what we say clinically as he allowed himself to be parentified. Now, what would happen, of course, in terms of schooling was that any day that he saw his father mildly upset or agitated or depressed, he would not go to school. So therefore, he'd become truant. And the problem then became one of the systems trying to respond and trying to get this kid to go to school, and of course threatening him and threatening the mother with fines and all this other crap. So basically, when we actually got involved in this, and there was a referral to me as the mental health therapist and the team that I was part of, and we kind of began to understand, and we simply said to the boy, in terms of, you know, we talk about youth engagement, we talk about empowerment. So we did that. We said to him, well, what do you need to go to school? And he said, well, you have to guarantee that my father's going to be alive when I get home. Seemed like a perfectly reasonable request. So how do we do that? Well, we started working with his psychiatric team at the hospital where his father was receiving care. And we began to sort of get them to sort of pick up their game a little bit, make sure there were enough supports in the home to support the boy. And then as we went along, we even went further. We actually got the boy, who was all of 12 years old at the time, a place on his father's treatment consultation team. Now that took a bit of selling to the psychiatrist, right? You can imagine, yeah, we'd like to put a 12-year-old boy on his father's psychiatric team, the one who's actually going to be the person most knowledgeable about his dad. And they went, well, won't that re-traumatize the kid? And we went, he found his father swinging from the rafters. Do you really think that could get much worse? In fact, why don't we as adults stop being so idiotic and protective, and why don't we actually let this boy get what he needs? He participated, and he started going back to school. And the reason I'm raising that example is, how do we evaluate that? How do we evaluate an intervention like that? How do we show that what you had there was a treatment team, a mental health team, that had provided a comprehensive plan of care, advocacy, integrated service planning? Notice that's what I'm talking about. We eventually did trauma-informed therapy. We did those sorts of more cognitive behavioral treatments that helped him deal with the trauma. But that's not what made him resilient. What made him resilient was an entire constellation of services that had coalesced together to give him opportunities to experience real empowerment. So what I'm beginning to understand, when we're sort of talking about assessing resilience, there's a basic concept here, and I know it's a little controversial, but I'm going to throw it out anyways, because the research clearly shows that when kids, or anybody for that matter, is in a context of more cumulative stress, where there's more risks before them than the average. Actually, it's factors usually outside of them, the systemic factors which are going to most predict their well-being, not the individual factors. Individual factors are important, but changes at the individual level do not, in the research, account for dramatic changes to individuals who are under a lot of stress. If you're under very little stress and you live in a relatively safe, secure environment, then yes, it's about an evoking personality, it's about a certain personality type, it's about IQ, it's about attribution styles. All those things are going to matter. But as you enter the deep end of crisis, the research is very clear that in fact, it's going to be the quality of your family, your school, your community, and indeed even the social policies at the government levels that make a difference in a child's life. Now, what I'm actually doing here is I'm switching the paradigm somewhat. There's a kind of a debate in the field of resilience in terms of, and it has an implication for what we measure. You see, there are a group of people, such as Jay Belsky and others, who are talking about this concept of differential susceptibility. Now, think about it. If you're talking about a word like susceptibility, you're talking about your own personal quality. It's almost like an argument for epigenetics or neuroplasticity. It's about my capacity, my interactions with the environment around me. So in other words, you can assess me. You can say, how strong am I? How hardy am I? What is my genetic makeup? What is my susceptibility to a crisis, to a trauma event, like that boy, right? How is he going to respond? It's all about him. Now, there's another set of people thinking about resilience that are talking about measuring something slightly different. And I'm going to turn, instead of talking about susceptibility, what if we talked about impact? Now, that's kind of saying, wait. What if the source of our resilience is external to us? In other words, was the 12-year-old boy who found his father in that state of suicide, was he overcame it, he got back to school, on all the benchmarks of success, he would score very well as a resilient child. But what was the locus of change? Was it the boy or the systems around the boy? Imagine we'd come in, like most mental health teams, and simply said, well, look, you have to go to school, right? You're going to have to go to school. Tough. And yeah, your father's problems are your father's problems, and we're going to individuate you, and we're going to disengage you, and we're going to give you a nice little trauma-informed therapy individually in my nice little clinic once a week, right? Here we go. What do you think the boy would have done? He would have told us as a treatment team to completely go yourselves, right? He would have walked out of that situation, and then we would have blamed him or called him a vulnerable child, when the only part of the vulnerability was the stupid system that hadn't accommodated. In other words, when we're going to start thinking about this notion of resilience, I'm going to argue that what we really needed to assess was the differential impact of the systemic changes. So how do you capture that? Because if we only measure the child, we're going to miss much of the story. Now, that means that as evaluation teams, we have to not just talk about changes to the child, we have to capture changes to the world around the child. And we've been kind of specializing in doing this. One of the things that distinguishes the work that we do at the Resilience Research Center is this kind of notion of looking more broadly at the ecological factors. If you just think about it as a parachute, it's kind of lovely. It's a nice little parachute. And it actually cost us about $1 million and 8 years of work just to design this. This actually was a culmination of a large series of studies. What it says is, you see, we wanted to understand the connection between risk factors, resilience factors, and the way kids use services. So we purposely went out and we found a group of kids who are using multiple services. These are the kids in jails who have mental health problems, kids who are using special education services, who are members of child welfare services. All those, in fact, some of those kids were using all of those services at once. And from an evaluation point of view, what we wanted to know was what was the impact of services on kids' lives. And we found a couple of key things. I just want to show you what happens when you don't just assess the child, but you assess the environment around the child. So what we found, interestingly, was, first of all, kids who are exposed to a lot of contextual risk factors, those that bubble way at the end, were not the kids who received the highest number of services, which is the bubble over here. So we assess services two ways. First of all, how many services did you receive? And were you satisfied, or did you like the services you got? Were they appropriate to your culture, your context? Did they meet your needs? The interesting thing was there was no relationship, and there should have been. So kids who lived in the highest context, most dangerous environments did not necessarily receive more services. Isn't that odd? They should have, shouldn't they? And what we even found was odder is that the more the kid lived in a contextually, like a dangerous home, a dangerous environment, an impoverished place, the less satisfied they were with their service use experience. Now, there's a lot of other things about resilience up there. For instance, when kids like their service providers and engage with the service provider, they tend to become more resilient, and through that aspect of resilience, developing all those wonderful things we want kids to develop that make them more resilient, they change their outcomes. Things like they stay in school, they don't use drugs, they avoid high-risk sexual activities, they avoid delinquency. That is kind of the story that I can put together for you. But it starts, if you will, by understanding that you first have to assess the risk factors in the contextual factors that the kid is experiencing, and then to see whether or not that kid in that particular dangerous context is getting the kinds of services, not just lots of services, but the quality of the services that they're getting. When you begin to sort of tell that richer story, you see these patterns. And what I basically now tell governments is that, you know, really, we are missing the most vulnerable children in our communities, at least in North America, are not getting the services. And you can know that. How many of you have ever worked or know, you know this, right? It's the less vulnerable kids are the ones who have parents who can knock off of work and take the little guy off to see the addictions counselor or the mental health therapist. The parent who's the recent immigrant, who's working 3 jobs just to put a little bit of food on the table, can't take an afternoon appointment off to go see the guidance counselor at the kid's school. Can they? They can't in Canada. I don't know if they can here. So we've kind of missed sometimes the complexity of the systemic changes that are required to make kids resilient. I would argue, for instance, that if you were assessing the 12-year-old boy that I talked about, you're going to have to assess not just his well-being, you're going to have to assess the capacity of the systems around him to actually listen to him. How engaging was his school? Did he find services that met his needs? Was he empowered? Did anyone listen to him? Did he like the services that he got? Was there a network of people advocating on his behalf? Was there caretakers who could supplement his mother who had basically left the house? Where was he finding positive mentorship and all these other kinds of factors that were fundamental to creating the context in which he was going to be more resilient? The simply saying, well, there's a service there was just simply not enough. So let me show you an interesting case here. This was a case of a boy. We sometimes do studies where we're actually filming kids. So we do very in-depth qualitative work with kids. And this is a boy. He's 15 years old. He's an Aboriginal boy, so he's a Native Canadian child. He was taken away from his parents very early in his life and put into a foster home. Now, what's interesting about this kid is he's doing really well. Contrary to the odds stacked against him, he still goes to school. He doesn't use drugs and everything else. He's a great kid. And we found him for one of our studies. So we put a camera on him and we watched him all day long on a Saturday just to see, why is this kid doing well? Now, think about assessing this kid's life. If we just asked him some questions and said, well, why are you doing well? I don't know. He might have talked about, I don't know, going to school or something superficial like that. But if you actually meet this kid and start understanding his life, you see the most interesting things that he's doing. This kid leaves his foster home, wanders about 10 blocks away, and hangs out with his extended family. Is that neat? So he has navigated his way back to his extended family, who are culturally of his same culture, and that's where he hangs out. But he doesn't just hang out with his extended family. He actually goes further. He has a contributing role in that family. He looks after the babies, his cousins and nephews and nieces. He actually has a dramatic role to play in that extended family. What you have here is factors like cultural continuity and making a genuine contribution to another's welfare and all these kinds of wonderful things. Sounds great, doesn't it? There's only one problem. the house he goes to is also a house where the drug dealers all hang out. And they run guns, and they sell guns, and they deal with drugs and everything else. In other words, you see, there's a lot of complexity to resilience. If we just take a superficial view and say, well, you know, a kid whose peer group has to be socially desirable, therefore he's resilient, you've missed it. What if there are no socially desirable peers? How do we tease out in our evaluations the complexity of children's real pathways to resilience? And, you know, this kid's doing well. This is where he hangs out. He's with other native peoples. There's a cultural aspect to his life. It's great. And he likes to play with the children. And then we have hours of him basically holding the babies like this, looking after the children, being a caring adult to someone else. It's just really important to think about, how would you assess this boy? You know, how would we gather this narrative of this child who is actually doing really well, even though he's hanging out with drug lords, drug dealers, and he's in this all kinds of dangerous place? But could you see that there's something positive there? And we need then, I think we need measures, we need ways, and I know that this is challenging to do. But I am going to say that in this combination of qualitative and quantitative methods, the reason we use those both methods is because we know that we want to capture those nuances of children's pathways to well-being. So let me give you some examples of where we even get muddled in the quantitative. For instance, do we ask children about their hobbies, or do we ask them about their capacity to care for family members? You see, there's a lot of bias in the study of resilience. There's a difference, in fact, I'm going to argue there's a difference between assessing what we think are signs of resilience from the standpoint of those of us who are privileged. I have 2 children. You ask me, my kids have hobbies. The children I work with in my clinical practice do not have hobbies. They look for food. They try and keep themselves safe from parents who have severe addictions. They manage to barely get to school. They survive. Right? So why would I ask a kid like that, do you have a hobby? Isn't that kind of stupid? Now, if you say, do you have interests that bring you outside the home so you're less exposed to the trauma at home? Yes, that's a good question. But to imply that somehow there's a superficial hobby misses the point. In other words, do we design our questionnaires and our evaluations to capture elements of resilience that are more appropriate to children under risk? Or do we ask them questions which are more appropriate to those of us who are privileged? This is a serious problem. Let me give you the second one. Do you ask children about their school grades, or do you ask them, are they multilingual? How many of your measures are asking kids, are you multilingual? Let's face it, how many of the kids in your samples are you going to be immigrant children who had to acculturate to the dominant culture of England? One of the biggest predictors of acculturation is going to be language skills. Do you ask them, how many languages do you speak? It would be a totally reasonable question to ask a minority, and a ridiculously silly question to ask my own children. Because they are the dominant culture, so we don't ask them about multilingualism, do we? It's a terribly powerful predictor of well-being for immigrant families. Can I keep going? Compliance with social expectations or resistance to racism and marginalization. Do you ask kids, okay, do you know how to behave? Or do you ask, when someone disses you because you're poor, or stigmatizes you because you have a language disorder, do you know how to talk back and fight back? Do you know how to stand up when people put you down? Oh, wait. Is that a skill of resilience? You're darn right it is, in a context of marginalization. What about community engagement? Or do you ask about the quality of our community's efforts to engage? Like, in other words, you say to the kid, do you participate in sports? Or do you ask the community, has anyone made it possible for this kid to get the kit that he needs to participate in sports? Who's to blame if the kid is not in a sports club? The kid? The family? Or the social community that surrounds the kid? And the assessment, the implications for this is that changes how we assess resilience. Let me leave you with one other thought here. You know, it's funny, but I do this work all over the world and developing these ideas about resilience. Quite often my children over the years have got to travel with me. We have partnerships all over the globe, including in Tanzania. And one of the interesting, most sort of humbling aspects of this work is you realize that actually, despite the certainty of a presentation like this, we really do know very little about what predicts resilience. The factors that we can actually say are going to make a kid survive adversity, we know very little. And we know mostly kids, well, who look like me, right? That's the kids we know most about, but not about the other kids around the world. So I'm always very cautious. This is a picture taken when my daughter came with me to Tanzania when we were first developing some of these theories of resilience and some of these ideas of a more ecological approach to resilience. She, by the way, if you can't pick her out, my daughter is the fifth one in there. She went to school one day with some of the children of my colleagues who we were doing the research with. And I love this picture because my daughter is evidently outnumbered. And I'm always cautious that when we talk about resilience that we make sure we pay attention to the fact that what we think about resilience largely comes from a very small minority of people on this globe. Even if you're talking about children with disabilities, physical disabilities, we know very little about their resilience. If you're talking about children with learning disabilities, we know very little about their patterns of resilience. So our assessments have to be broad and multidimensional, qualitative and quantitative. They have to acknowledge that children's pathways will look very different depending on what the context is and whether or not we as communities give them what they need. That's why I think the nature of assessment in this field has to always be sort of layered and nested and necessarily complicated. Thanks very much.